The Dalmatian wouldn't stop licking the baby's right ear. Not the left, not the face, not the hands, the right ear. Specifically, the posterior auricular area, the soft skin behind the ear where the skull meets the neck. Derek and Mia Sorensen had 3 explanations in the first week. Residual formula, baby lotion, the particular sweetness that babies apparently exude from specific anatomical locations, according to Derek's mother, who had raised 5 children and considered herself an authority on infant-related canine behavior. By the second week, none of those explanations held. They had switched formula, they had stopped using lotion behind the ears. The sweetness theory collapsed when the Dalmatian, a 3-year-old female named Domino, ignored the left ear, the forehead, the neck, the feet, and every other part of 7-month-old Jack's body to focus exclusively on the right posterior auricular zone. Mia started pushing Domino away. Derek started closing the nursery door. Their pediatrician, during a routine checkup, said dogs lick babies for attention and salt. Nobody said what Domino was actually detecting. If you stay for stories about the ones who lick with purpose, subscribe to the Faithful 4. Week 3. Jack developed a low-grade fever, 100.2 degrees. Normal range for teething, the pediatrician said. Tylenol, fluids. Monitor, but Domino's licking intensified. She would press her nose against Jack's right ear, inhale deeply, then lick the same 1/4-inch patch of skin in rapid, concentrated strokes. When Mia held Jack, Domino stood on her hind legs and stretched her neck toward the baby's head. On day 23, Jack wouldn't stop crying. Not the fussy cry of teething, a sharp, rhythmic wail that peaked when Mia touched the right side of his head. She pressed gently behind his right ear. Jack screamed. The ER doctor used an otoscope. The right tympanic membrane was bulging, red and partially obscured by purulent fluid. A severe otitis media, middle ear infection, with early signs of mastoiditis, the infection spreading from the middle ear into the mastoid bone behind the ear. Mastoiditis is rare now because we catch ear infections early, the doctor said. But when it develops, it's serious. The infection erodes bone. Left untreated, it can reach the brain. The doctor paused. How long has this ear been bothering him? Mia thought about the licking. 3 weeks. 23 days of a Dalmatian targeting the exact anatomical location where bacteria were multiplying inside her son's skull. Has your dog ever fixated on a specific part of your child's body, and you couldn't figure out why? Tell us. Fixation is information. The ENT specialist who managed Jack's treatment explained that otitis media produces volatile organic compounds as bacterial colonies metabolize tissue and fluid. These compounds, primarily cadaverine, putrescine, and various sulfur-based molecules, are present in concentrations far below human olfactory thresholds, but well within the detection range of canine olfaction. The dog was smelling the infection through the skin and bone, the specialist said. The posterior auricular area has thin skin and high vascularity. It's the closest surface point to the mastoid process. She was going to the source, the same way a trained detection dog goes to the strongest point of a scent plume. The infection resolved. The mastoid bone showed early erosion on CT scan, but no permanent damage. The ENT said another week without treatment, and the outcome would have been surgical intervention, mastoidectomy, possible hearing loss, risk of intracranial complication. Domino returned to her normal behavior the day after the antibiotics began. She sniffed Jack's right ear once, a brief casual check, and walked away. The compound she had been detecting was gone. The source was neutralized. Job complete. Every lick that won't stop is a sentence in a language we haven't learned. Subscribe to the Faithful 4. Mia never pushed Domino away from Jack again. When the dog approached the baby, Mia watched. Which part of the body? How long? How intense? She turned the dog into a diagnostic instrument, not by training her, but by listening. Derek installed a small whiteboard in the kitchen. Every time Domino fixated on a specific area of Jack's body for more than 30 seconds, Mia noted it. Date, location, duration. The whiteboard was blank for 4 months. Then, one morning, Mia saw a new entry in her own handwriting. Left knee, 2 minutes. She called the pediatrician that afternoon. A minor skin infection, barely visible, caught before it spread. Domino had found it before the redness appeared. The whiteboard stayed on the kitchen wall. A record of surveillance, conducted by a 3-year-old Dalmatian with a nose that could read infections through bone, and a vocabulary that consisted entirely of the tip of her tongue, silent language, perfect grammar. The ENT specialist saw Jack for a follow-up 3 weeks after the antibiotics concluded. The CT scan showed complete resolution. The mastoid bone had healed, the middle ear was clear, and the tympanic membrane had returned to its normal pearlescent appearance. The specialist asked Mia how they had caught it. Mia told the story. The licking, the 23 days, the pushing away the moment Jack screamed when she touched behind his ear. The specialist was quiet for a moment. Then he said something Mia would carry with her for years. Mastoiditis used to kill children. Before antibiotics, it was the leading cause of pediatric meningitis. We rarely see it now because we catch ear infections early with otoscope exams. But this infection was deep, behind the membrane, in the middle ear space, migrating toward the bone. An otoscope at a routine checkup might have caught it in another 2 weeks. Your dog caught it in the first week. 23 days before you found it clinically, the dog found it biochemically. Mia looked at Domino, sitting in the car in the veterinary hospital parking lot, nose pressed against the window, watching through the glass. She's not a diagnostic tool, Mia said. No, the specialist agreed. She's better. Diagnostic tools wait for symptoms. Your dog detected the disease before it produced any. That distinction between detecting symptoms and detecting disease was the thing Mia thought about on the drive home. On the nights when Domino lay beside Jack's crib. On the mornings when the whiteboard in the kitchen stayed blank because the nose had checked and found nothing wrong. The whiteboard was a record of absence. Every blank day was a day Domino had surveyed, assessed, and cleared. Every blank day was a day the infection hadn't returned. The body was whole, the ear was healed. Silence was the diagnosis. And the diagnosticin slept on the nursery floor with her spots against the carpet and her nose 3 inches from the crib rail, running continuous surveillance in a language no medical school had ever taught.